Welcome to the training on occupational health, environment and safety. Let us learn the module on first aid for poisoning. Before we begin, let's take a look at the key learning objectives. After completing this module, you will be able to define poisoning, explain causes of poisoning, recognize and list the signs and symptoms of poisoning, demonstrate the first aid to be given for poisoning. Let us first learn what poison is. Poisons are substances that cause injury, illness or death. Poisons can be injected, inhaled or swallowed. First aid is required in saving the life of victims who are critical. The causes of poisoning are medications or overdose of drugs, insecticides or pesticides, carbon monoxide gas, certain cosmetics, occupational exposure, household plants like mushrooms, food poisoning, paints or detergents. Major signs and symptoms of poisoning are burns or redness around the mouth and lips from drinking certain poisons, breath that smells like chemicals such as gasoline or paint thinner, empty medication bottles or scattered pills if the patient is unconscious or unresponsive, vomiting, difficulty in breathing, drowsiness, confusion or other unexpected signs. Other symptoms of poisoning are: click each hotspot to know more. 1. Blue lips. 3. Difficulty in breathing. 3. Difficulty in breathing. 4. Vomiting. 2. Skin rashes. 5. Fever. 6. 7. 6. Headache. 7. Giddiness or drowsiness. 8. Double vision. 9. Abdominal chest pain. 10. Palpitations or irritability. 11. Loss of appetite or bladder control. 12. Numbness. 13. Muscle twitching. 14. Seizures. 15. Weakness. 16. Loss of consciousness. 17. Diarrhea. Call the local emergency number if you see a person drowsy or unconscious, having difficulty breathing or has stopped breathing, uncontrollably restless or agitated, having seizures. Now let us see the first aid to be given for different kinds of poisoning. Click the images to know more. 1. Carbon monoxide poisoning. If the person has been exposed to poisonous fumes such as carbon monoxide, get him or her into fresh air immediately. 2. Swallowed poison. If the person swallowed the poison, remove anything remaining in the mouth. 3. Household cleaner or chemical poisoning. If the suspected poison is a household cleaner or other chemical, read the label and follow instructions for accidental poisoning. Steps to be performed by waiting for medical assistance. Click the images to know more. 1. If the person is not breathing, start CPR and rescue breathing. 2. If poison is spilled on skin or eyes. If the poison is spilled on the person's clothing, skin or eyes, remove the clothing. Flush the skin or eyes with cool or lukewarm water, such as by using a shower for 20 minutes or until help arrives. 3. If you find the poison container, take the poison container or any pill bottles with you to the hospital. Now let us see what first aid is to be given for a person who inhaled poison. Click the images to know more. Step 1. Call for emergency help. Poisoning by inhalation can lead to serious medical issues, and it's important to get emergency medical professionals involved. Step 2. Leave the toxic area immediately. Poisoning by inhalation can occur as a result of toxic fumes, smoke, or gas. Move the person and anyone else in the vicinity to an area safe from these substances. Step 3. Check the person's breathing and pulse. If you don't feel the breath or a pulse, administer CPR immediately. Continue checking the person's breathing and pulse every 5 minutes until emergency help arrives. Step 4. Keep the person comfortable. Have the person lie down on his or her side, recovery position, so that he or she won't choke in case of vomiting. Food poisoning is very common nowadays, so let us see the causes, symptoms, and first aid for food poisoning. Click the images to know more. 1. Causes. Poor handling of food, improper cooking and inadequate storing of food helps to grow bacteria, which causes food poisoning. 2. Symptoms. Diarrhea, nausea, abdominal pain, vomiting sometimes, dehydration sometimes. 3. First aid. Rest and drink plenty of liquids. Do not use antidiarrheal medications. Call emergency if the symptoms are severe, such as watery diarrhea. Certain things we should not do for poisoning. Do not give an unconscious person anything by mouth. Do not induce vomiting. A strange poison that burns on the way down the throat will also do damage on the way back up. Do not try to neutralize the poison with lemon juice or vinegar. Do not use any cure-all type antidote. Do not wait for symptoms to develop if you suspect that someone has been poisoned.